The HIV pandemic in Uganda continues to leave its destructive mark on the population landscape of the country, as the current figures from the 2012 Joint United Nations Program on HIV/AIDS tell the story. 1.6 million, the number of people living with HIV. 790,000, the number of women aged 15 and above living with HIV. 190,000 children aged 0 to 14 years living with HIV. 63,000 annual deaths due to AIDS, and 1 million orphans due to AIDS aged 0 to 17 years. Through its channels of hope for HIV and AIDS model, World Vision Uganda prepares and equips faith leaders to respond to HIV and AIDS in a comprehensive manner. It challenges participants' existing beliefs regarding HIV and AIDS, reduces stigma and discrimination surrounding these topics, and encourages faith leaders to show compassion for people affected by and living with HIV/AIDS. Faith leaders are uniquely placed to protect the rights and meet the needs of the most vulnerable in their communities. They have profoundly deep trusted relationships and links with their communities, and often dictate which behaviors are prescribed or prohibited. Faith leaders are not automatically equipped to further the cause of the most vulnerable in their communities. But with the correct training tools, they can become the change agents that their communities require in order to raise their children adequately. In the Bundibujo Area Development Program (ADP) in Western Uganda, World Vision Uganda, under its Church Partnership for Child Well-Being Project, trained Vincent Bale in the channels of hope for HIV and AIDS model. Vincent works as a catechist in Intandi Roman Catholic Church in Bundibujo. After the training, Vincent mobilized leaders from other faiths, and together they formed a community-based organization known as the Greater Kasitu Congregation Union, or KAKU, K-A-C-U. Through KACU, Vincent identified a widow in his community named Elizabeth, who was living with HIV.
When training for channels of hope came in, I also went around sensitizing communities. I even did it in our churches, whereby I also met her and sensitized her on channels of hope, and also she gave me, she told me all about her. And when she gave me the story, I told her that she was not all that okay. She was only waiting to receive some kind of death. But when it came, when she told me her problems, I counseled her and she went for testing. And when she went for testing, she found her being infected. And when she got infected and she said no, what to do, then I started advising her to go for medicine.
World Vision Uganda helped Elizabeth to set up a small business that generates income for her and her family. World Vision Uganda also constructed a house for the family. And as a result of this intervention, their overall condition of living has improved tremendously. At the nearby Bundi Masoli Christian Fellowship Church, led by Pastor Bagonza, World Vision helped to change the lives of two young men through the channels of hope training. Robert is 22 years old, and he is a Sunday school teacher at the church. He lives with his cousin, Ronald, who is 15. Before the training, Robert had noticed that Ronald was always isolated and never mixed or played with the other teenagers at the church. He did not think much of it though, but after undergoing the Channels of Hope training, he realized that there must be something wrong with his cousin. Using skills acquired from the training, Robert had sat down his cousin and they had a heart-to-heart chat. Ronald opened up and shared with Robert how he was always falling sick and had started skipping school, but he had no one to share his fears with. Ronald encouraged him to go for testing, and Robert was found to be with HIV.
After going in those World Vision meetings, then I went to the hospital with Robert to have a test. Then after testing, I was positive.
Although they were both devastated by the news, they determined to make the most out of the situation. Ronald was started on treatment. His health improved, and with Robert's encouragement, he joined the church choir and the Sunday school team. He now plays drums for the church, teaches the younger children in Sunday school, and is much more sociable than he was before. With Robert's moral and physical support, Ronald's life has changed dramatically, thanks to the Channels of Hope training by World Vision Uganda. He is looking to the future with hope, and he has his goals set on becoming a pastor when he completes his education.